Mr. Mayor.
Good afternoon. How are you, Chuck?
Good. We'll get going here in just a moment.
Yeah.
Okay, I think everybody is here. We'll go ahead and get started. I am Chuck Carney, Director of Media Relations and spokesperson for Indiana University, here as always on Friday for our virtual news conference with leaders from the city and the county and Indiana University and Indiana University Health. Today with us, as always, we'll have Mayor John Hamilton, the city of Bloomington, Monroe County Commissioner Julie Thomas, IU Health South Central Region President Brian Schockner, Monroe County Health Department Administrator Penny Caudle, and IU Assistant Vice President for Strategic Partnerships, Kirk White. And again, as always, we'll go to Mayor Hamilton.
Well, thank you. Good afternoon to everybody. Hope you can hear me all right. I am, like all folks in this call, glad to see continued positive signals in the data about COVID-19 and the coronavirus in our community, with hospitalization numbers and the incidence of the disease and the testing that we have. You know, we've reopened City Hall. It was closed to the public for 4 weeks. We've continued all of our employees on the job, but we reopened that last week. We're getting a small number of people in each day. Just as an example too, the Twin Lakes Rec Center opened up as a recreational center, and we're seeing very low attendance, I think reflecting the fact that a lot of people still are being very cautious, and I think that's a good thing. We did announce the pools, the two public swimming pools will not open this summer, a direct result of the coronavirus challenges and the ability to get lifeguards and get them trained and have capacity and kind of some of the finances of that too. So in a way, I would just emphasize we are in the marathon. I think in some ways the first sprint, the 12 weeks, we may be into the marathon after really intense sprinting over the last 3 months. But we're in a marathon. And I guess one thing I want to say today is it's not clear that we may get another sprint. We have to be continually vigilant and careful so that we don't get into another sprint or surge or demand, including some people see the news about the long-term care facilities where a facility can face a really blossoming of infectious diseases that can cause real problems. We know Indiana University has very intentional and thoughtful plans for the fall that will be another episode to determine whether we have a sprint or not. And even this afternoon, in a couple hours, we expect to have hundreds of people gathering for protests about racial justice. And my heart is with them in those protests. But we also know a gathering of many hundreds of people is going to be a challenge to the health crisis that we have. And I know people are working hard to be sure everybody's masked and trying to be physically distant. So we all will be encouraging continued preventive steps, wearing masks, staying 6 feet apart from people, and particularly having masks if you're closer than 6 feet to anybody, knowing that outdoors is safer than indoors for this, and continued hygiene that we've talked about before. I'll just close noting that the two working groups that we've stood up now 2 months ago are very active. The Economic Stabilization and Recovery Group continues to identify how are we going to kind of climb out with the economy. There's more than $1.5 million that have gone out to help support businesses, and they're continuing to work on that. And the Social Services Working Group has done terrific work with our partners all through the community to continue to support the sheltering that we see needs for, the food security that we know is so important, the childcare for workers that is so important, as well as personal health and safety. So good signals continue in the data, but vigilance is definitely needed. And I hope everybody will stay safe and protect yourselves and everybody yet this afternoon and through the rest of our days. Thank you.
Thank you, Mayor. I'm told that Lee Jones, Vice President of the County Commissioners, is going to be speaking for the commissioners today. So, Lee, I'll call on you.
Thank you. I'm not quite sure if my video is working.
You're no video at this moment, just seeing your name.
Okay, I'm not sure. I have a very bad connection, so maybe it's just as well it isn't working. Mostly, I just want to bring you up to date with what's going on in the county. The commissioners are going to be hosting a blood drive at the Monroe County Convention Center on June 23rd. And of course, anyone in the county can go ahead and make an appointment to donate blood, which we're pretty sure is going to be very much needed at that time. We're going to be starting our board and commission meetings up again on June 15th. We haven't had them meetings since the beginning of this crisis, and it's definitely time to get them back to work. And at our last commissioners meeting, we made the decision to expand grant recipients from the food and beverage tax dollars to include people who are, or businesses who are in the city, but their services go to the entire county. And we are still accepting applications for the food and beverage grants, which mostly are for businesses from outside the city of Bloomington, which have been affected by the pandemic and have some connection with tourism. To date, we have granted $245,000, and I would like to point out that these are grants and not loans, so they're really helping people out. And I think that's most of the update I have.
Okay, thank you, Lee. We'll go next to Brian Schockner with IU Health.
Thank you. I want to just express our thanks to the community because we do continue to see low numbers of hospitalizations. But I also want to say thank you in these economic times as more data continues to come out to the commissioners in the city of Bloomington, and express how lucky we are to have the support to businesses and the grants and the funding that they're supporting to those businesses that are important to us as citizens, as well as the economics. And so I just want to say thank you for that. It's very appreciated. The couple things I want to talk about is a safe care and safe care pledge, and then some mental health, minding our mental health during this period as we continue to see some concerns that occurred. IU Health has kicked off what's called a Rest Assured campaign this past week. And we are really dedicating ourselves, as we always have been, to keeping patients and visitors and team members safe through social distancing, wearing the mask, and all the things that we've been putting in place. But we want to remind people that we have a universal mask mandate in our facilities, and we'll continue that until such time as we have a cure, a vaccine, or a way to prevent the spread of COVID-19. So all providers and patient-facing team members will wear masks at every IU Health facility, and will continue to. And we will ask our patients and visitors to do so as well. We will be releasing and just actually relaxing our volunteer and visitor restrictions here coming soon, but we will not relax all the requirements around masks, and we will not relax the requirements around social distancing and the things that are important. Limited waiting and seating and social distancing will be practiced, so there will be limits to the number, continue to be limits to the number of people, even with the relaxing of visitor restrictions that can come, and where they can sit and where they can be in our facilities. And then continually disinfecting. We know the chemicals that work. We have great opportunities and great technology to be sure that everything is clean and safe. So we in the healthcare community are the safest place to be as far as cleanliness and support for care. And so that Rest Assured campaign is to ensure that our community knows that they should not put off health and seeking health care because these are times where you are safest in your healthcare provider's locations. And then we're always ready. We are always ready for a surge. We are always ready for anything that should happen with IU students coming back, as we have learned a great deal over these past 10 weeks. And we know that if we do see a surge, we can quickly ramp up and down our operations to comply and care for those in need. Then I want to move on to minding our mental health. COVID-19 has impacted us all. Even if you've not personally contracted COVID-19, the social distancing, social isolation from friends and families is causing us to experience some mental health issues across the regions and across the state and across the nation. And we're seeing that in our behavioral health care. We have seen double the number of patients with anxiety and concerns during this period of time they're directly related to social isolation, fears, anxieties in the community, fears of the virus, and other things. So even before COVID-19, about 1 in 5 Americans were affected by anxiety to a point where they needed to seek some type of help or support. But now more than ever, there's a heightened sense of awareness in the mental health concerns that we face on the effects of the COVID-19 crisis. So we would ask that we all acknowledge that, and that we all reach out to each other and we seek support when we need support. It is important during this time. And so we'd ask, there's a couple sites that we'll post in the comments regarding visit iuhealth.org COVID-19, your health and wellness for mental health and wellness resources. And if you need immediate help, we would ask that you visit the Indiana Suicide and Crisis Hotline pages. And you can also call 1-800-SUICIDE, 1-800-273-TALK. It is a situation across our nation and in our community specifically, as we've continued to see continued increases in those who need help and those who seek help. Thank you.
All right, next we'll go to Penny Caudle.
All right, thank you for having us today. I appreciate that. Allison Moore, our EMA director, did send me an update. She wasn't able to be with us today and wanted me to remind everybody about the blood drive. I know Commissioner Jones mentioned it as well. June 23rd from 10 to 3, the blood drive will be held by Red Cross at the Monroe County Convention Center. You can call 800-RED-CROSS or go to redcrossblood.org to schedule an appointment. You must have an appointment so that social distancing may be maintained during that event. Flyer can be found on the Monroe County Emergency Management website. And this is an event that's sponsored by the Monroe County Commissioner's Office. So we do ask that people donate if you are able to keep life-saving blood flowing for those who need it. And in terms of the health department, a few things that I wanted to highlight today. Fairbanks IU School of Public Health has started phase 2 of COVID-19 study. It started on June 3rd and runs through June 7th. Monroe County has had a site running from Wednesday, June 3rd through today. And we hope that anyone who received an invitation, whether it was text or email or a postcard, accepted that so that we can get lots of participation and more good data. There are some additional sites, I believe, that may be set up later to kind of fill in where gaps may have been seen in terms of people coming through those sites throughout the state. Our local data is holding well. We continue to see a few cases, new positives, but also our number of positives out of the number of tests that are being done continues to increase. So today we had 171 cases reported on the state's dashboard, with a percentage of 4.5 of those were positive. So those are encouraging numbers. We like that our positivity rate is still going down. The influenza-like illness and the COVID-like illness is still decreasing. And as you heard, the hospital reports remain stable and good. New contact tracing process is up and it's going, and it's continued to see enhancements to the trainings that staff are receiving and the communications with local health departments. Testing options continue to grow, and the Optum site can now see children. So up until just recently, you had to be over 12 years old. So parents who may have younger children that they think may need to be tested, maybe they're symptomatic, they could take those children through that Optum site. Health department staff are working with local schools and universities in planning for students' return to classes this fall. The Department of Education and the CDC has both issued guidance, and more is expected. And this is complicated, yet it is doable. It will take all of us maintaining our diligence and precautions so we can avoid a surge that requires closures and restrictions returning. So we talk about this all the time, that we need to continue that social distancing and the face coverings and staying home and all of those things. It is too early to say, let me go back. Is it too early to say, please get your flu shot this fall? We need to reduce influenza illness and hospitalization, so any surge in COVID will not be complicated by influenza-related hospitalizations. So I know that fall seems like a long way away, but I will just say, put that on your fall to-do list to make sure that you get your flu shot this year. School reentry guidance, I did mention that the Department of Education has put out some new guidance. I think that came out today. And I do want to say that people are watching as businesses are reopening, and all of them are following the guidelines, especially with regard to face coverings and distancing. But people and patrons are watching. We are getting complaints about those businesses who are not complying, and we are following up on those. And I would just take a moment to remind patrons that when you see an issue, to be sure that you say something to that manager of that business so that they're aware of the problem, that they know that you are willing to pay attention and to take your business to somebody who is complying with the rules, if you need to do that. And please wear your face covering for those employees who are working at that facility. So again, they're wearing their face coverings for you. Please wear them for those workers. We do have reports as well that there's some bad batches of heroin, as we're hearing reports of more overdoses over the last few days. So we do encourage anyone who may need to carry naloxone, whether it's for them or for a friend, that they have that available and that they know how to use it. People who are interested in being trained in obtaining naloxone, they can contact the Indiana Recovery Alliance or the Monroe County Health Department for that information. There's also new guidance out for those individuals working in agriculture, and that's just been released, I believe, as well. So if we have farmers or people working in agriculture that want to look for particular guidance regarding certain things, that guidance is available. And then finally, I would just say immunizations. Remember to keep your immunizations up to date. Thank you.
Okay, thank you, Penny. Let's go next for our Indiana University report, and Kirk White.
Thanks, Chuck. This week, IU continued our phased-in approach of getting the campus back up to operating speed. This week, our facilities staff is back on campus at full speed, and we started the research enterprise back with that research that had already been started, that had been discontinued for a while, back with the faculty and grad students that are able to continue work on those projects. This is all part of our back to work initiative. And next week, there will be a guide published for our employees about how to come back to work and what those expectations are. That's in the planning stage right now. As part of that, there will be a Healthy Hoosier commitment that we'll ask our faculty, staff, and students to sign that discusses and makes a personal commitment about the protocols, physical distancing, the face masks, and other things that responsible people do to help curb the pandemic. I would like to mention this week about the initiatives that the university has undertaken, really at many of our campuses to support research for all types surrounding the COVID-19 pandemic. And I'll put a link to our website that goes through many of those programs and initiatives that you would expect a major research university to be working on. And we've partnered with many others and are part of the national effort to find vaccines and additional treatments for the disease. And I think there was a question about whether the IU pools would open, the IU pool on 17th Street. At this point in time, all of our recreational sports activities and facilities are closed, as really most of the campus is still in a situation where we're telling people not to come back until we're able to put the healthy guidelines together for our employees. So at this stage, there's no answer about when the pool will open, if it will at all this summer. So no news on that at this point. And then there was another question about our School of Public Health, both the Bloomington campus school as well as Indianapolis. Those schools are working closely with local and state, and in some cases national initiatives. You'll see that Dean David Allison from the Bloomington campus and Paul Halverson from the Indianapolis campus are working with state officials as well, helping advise them and use our resources along those lines as well. And finally, I'll follow up with what the mayor mentioned about the peaceful protest that will be starting on the campus here at 3 o'clock at Dunn Meadow. And the crowd is expected to continue its movement on down 7th Street to the courthouse. And in addition to what the mayor very appropriately said, and asking folks to continue their physical distancing and face masks, we'd also encourage everyone to bring a bottle of water with them because it's hot today. And I would caution folks about the heat exhaustion on a day like this. Thank you.
All right, thank you very much, Kirk. And you did put up in the chat on Zoom, but for those of you on Facebook, research.impact.edu/coronavirus is where you can find all of the research that's going on related to coronavirus, and a lot of that through the schools of public health. And Penny referenced that the second phase of the School of Public Health Fairbanks School in Indianapolis has started on checking out the numbers in actuality of COVID cases that we have here in the state of Indiana. Really important study that's going on. So let's move through some questions here. And actually, I'm gonna back up a bit here since we did talk about the march here. Aaron Cantrell from Fox 59, this is not COVID related, but we'll go ahead and, since we're on that topic, get into this. Wanted to ask the mayor a question about the protest. What are your thoughts about the protest happening today, your hopes for it? How much will the Bloomington Police Department be involved? And does the city have any concerns about the protest?
Well, this has been a hard 10 days for a lot of members of our community, and of course across the country. And our hearts go out to the issues of racial justice that have been made so stark and so painful in Minneapolis and Louisville and Georgia and many other places. So my heart is with the protesters who are urging that we continue to do the work that needs to be done to recover and remedy the scourge of racism, which is still all among us. And so it's not at all a surprise that in Bloomington, a city that has had many protests and marches and rallies, many of which I've been part of, that we have probably hundreds of people who want to make their voices heard and make their active demands for better justice in our country and our community heard. We welcome those protests. That's how change happens in lots of ways. We know every community can get better, and we're committed to doing that here. Of course, we're very committed as well to trying to keep everybody safe. I will say I've personally been in contact with the organizers, two young, really impressive IU students who've helped kind of get this together. I believe they're fully committed, as I'm sure the vast majority of people are, to peaceful, active protest urging change. We do, and when you have a large gathering, there are concerns, and we are focused on safety for everyone, protesters and everyone. And I fully expect that we'll have a safe engagement and protest and look forward to that. We do have to be ready in case contingencies happen. And certainly our police are very experienced in protests, in facilitating peaceful protest, protecting everybody's safety. And that's what we look forward today. With the special overlay of COVID, it makes it even more complicated. And again, the importance of wearing masks and trying to keep physical distance and as Kirk wisely said, hydrating. I will say it's been striking. A number of the businesses in our community have already put statements on their windows and are planning to support the rally and the march. And I think our community embraces the goals that are behind this of unifying us all together in a better community and better country.
And just,
Chuck, if I could, I'd just add that we at Indiana University particularly appreciate the cooperative relationship that we enjoy with the Bloomington Police Department. And IU Police, the IUPD, is working closely with BPD. And the top priority, as the mayor said, is to assure the safety of this peaceful protest, because this is important for our community. It's important for the campus that these voices are heard safely. And so I'm just very thankful today for this good relationship. I know that the leaders of IUPD and BPD as city and university are working closely to make sure that everything we can do to keep this safe and productive is being done. And that's something that doesn't happen in every university community, but we certainly enjoy that here in Bloomington.
thanks, Kirk. And I can tell you, I am working out of the Von Lee today, and I have a window here where I can see people showing up, and they've been coming for the last couple of hours. It looks like it will be a sizable crowd that will be here. Related to that, a question from Binta Boutier from WFIU-WTIU. This is for Brian. How does IU Health plan to respond to prepare to potential surges after protests and voting and student returns that are coming up?
So in the initial public forums here and our news press conferences, we still have our incident command stood up. So every day at 9:30, we huddle. We were doing that around the clock, but now we're doing that every day at 9:30s. And we look at all the situational issues that could occur regarding any spikes in testing, numbers of tests, number of patients coming in our emergency room, the health department, anything they have for us. And so we are prepared to act in a moment's notice and can at a moment's notice. So our complete incident command structure is in place, and we can respond to anything COVID related or anything non-COVID related that would stress our resources in any way. So we've not stood that down. We continue to keep our incident command structure in place, and we'll continue to do so most likely through the end of the year.
Okay, Emily Ernsberger had pretty much the same question to begin with, but also asks, despite the steady numbers that we have seen, it's anticipated that many people are planning to come from outside Bloomington for the march today. Will you increase contact tracing? This is for anybody.
I can take that one. There really isn't a need to increase contact tracing because it stays the same whether you have one case or whether you have 1,000 cases. So each person is going to be interviewed. If they are positive, you're going to determine who else needs to be contacted, and then that process moves forward. One of the reasons that the state health department decided to contract that work and make that available across the state was for those surges and the increase to local health departments to the work. So the fact that the state has those contact tracers in place to handle that, our public health nurses follow up and assist them as need be. So if they have difficulty contacting somebody or there's a particular situation that needs some more local attention, then our public health nurses will do that.
If I might just add, and appreciate the capacity for tracing, it is worth noting, if there is a gathering of a few hundred people, the odds are quite likely that there are going to be somebody with who is infectious in that group, just given the odds of the population, and they may not know it. And it does make contact tracing difficult if you're in a march next to a bunch of people, because you don't always know who you were with. So it is a reminder that in these kind of gatherings, outdoors is good. It's just so important to keep the masking and the distancing as you can to try to keep everybody safe, because we want as Kirk noted so well, we want the protests and the activity and the advocacy to happen, but we want to protect people as best we can.
Again, related to the health issues in the march today, this is from Benta Boutier again. For IU Health and Monroe County Health, are there more medical staff today in case they need to respond to needs that may come up during or after the protests?
This is Brian, I'll take that one first. Yes, there is. So again, we are still under incident command. So we still have extra staff that are not caring for patients in their normal clinic practices that are redeployed toward support for COVID-19 and other things. We also, as a reminder, have the IU Health EMS service. And so that EMS service is well prepared and has been in conversation and working with the city and with IU to be sure that we're ready for anything that would happen. And as we said, I think Kirk said it, bring some water with you, because we could have those kind of issues. That's what we're expecting, nothing more than that. But we need to be there and support them as well. So yes, we have known about this for some time and are prepared to respond. But we certainly expect this to be a very peaceful protest.
Okay, and a question about Golden Living. This is a Facebook question. Is there an update on that facility?
I don't have a specific update for that. I would say all long-term care facilities obviously are vulnerable to an outbreak of COVID-19 simply because of their demographics and the residents that are there. Almost all of them are over 65. They have underlying health conditions. And the health department, while we do get positive test results on people, the reporting goes directly to the state health department, the reporting of positive cases from the labs and the facilities, and also death reporting is directed to the state health department. So again, contact tracing is done primarily through the contact tracers that the state has set up. Our public health nurses then follow up as need be on special cases. Our nurses do contact local long-term care facilities to make sure that they have the PPE that they need, that they have guidance and direction on how to care properly for patients. And if they have questions, we can help set up strike teams for them as well. And I know that the state is working in terms of enhanced reporting techniques and ways that they may be able to enhance data out to the community.
If I could just add, our extraordinarily talented and dedicated public health official is also extremely diplomatic, and I appreciate her about that. But I would just say, I think the state policy should be different. We could be like other states and really require more transparency by facility so that we all know, and so that the news media know, and that the public knows more details about where these kind of events are happening. It's pretty difficult to get fully accurate information on facilities like this. And I think that's a policy decision that could be improved with more transparency. But I appreciate everybody doing all they can to share all the information that we have that's accurate, that I know our people are doing so well, and managing each facility as they can. I just think the information should be a little easier to get and more public at the state level. Okay.
Another question, this is going back strictly to today's march, and this is for Mayor Hamilton from the B Square Beacon. and Dave Askins. Based on what I've seen for the protests that have taken place around the courthouse square every night since last Friday, Bloomington Police Department's basic strategy seems to be to keep a pretty low profile and block upstream intersections to keep automobile traffic away from the protesters when they take to the streets. So from where I've been standing, it looks like the basic BPD approach is to try to keep protesters safe, but there's probably going to be way bigger numbers of protesters today in Dunn Meadow. Does BPD have enough officers available to keep protesters safe today?
Well, thanks for the question. Yes, we believe we have the sufficient officers on hand and enhanced group with a larger presence and with the collaboration of many partners like IU Police and others as needed. It is accurate to say that the police really do focus. We have protests many times in Bloomington. We welcome them and they're part of our DNA. And so you're right in the sense that most of what police try to do in those kinds of activities is work with the organizations organizing to pick safe routes, to pick safe protocols and follow those. It is also right that one of the more dangerous things that can happen often just purely by chance or accident is the intersection of human beings and cars or automobiles or vehicles, which can happen when protests move into streets that aren't organized or vehicles in ways get to places where they normally can go, but they can't go. So there is a lot of efforts made to keep vehicles and protests like this separate. There's a lot of focus on that with the underlying focus being how do you keep everybody safe? And that'll be a big focus today too.
Again, from Dave at the B Square Beacon, again from Mayor Hamilton, theoretically, could BPD go onto the courthouse and enforce the anti-camping county ordinance, or is that solely the jurisdiction of the sheriff? Have you as mayor directed the police chief to have BPD officers to take or not take any specific actions on courthouse property?
The last question, no, I have made no specific direction on that. And again, the city and the county work together, fist in glove, hand in glove. Our sheriff and our police departments work very closely together. There are overlapping jurisdictions all over, but I know they're coordinating their efforts, and we fully expect, with this peaceful protest that all that will go well, and they'll continue to collaborate as they always do. I don't know if the county has any other comments about that too.
Okay. Lee, I think maybe you were trying to say something, but it looked like you were muted.
Sorry.
There you go.
Traditionally, the BPD has pretty much left the courthouse and the courthouse lawn in the care of the sheriff. But of course, there are commitments to help each other in times of emergencies or anything like that. And we do work closely together. So I think this situation is going to be well covered, and our various departments will cooperate very well on this.
Okay. Seeing no other questions here on the chat, I will take a moment here to allow some more questions if there are some. We still have a few minutes left. In the meantime, I will give a shout out to Etta Callahan, my colleague here at IU, for making my own personal IU branded mask. So I will be sporting that outside shortly here. And I do encourage everybody to wear their own. It looks like right now, if you want the weather report based on the window that I have in front of me, it's slightly overcast, might not be as hot as we expected it would be if you are going to be out at the march this afternoon. Again, seeing no other questions, we will plan on resuming this again next Friday. We'll be back at the same time, and you'll see the advisory come out on Friday morning. Thanks, everybody.
Thank you, Chuck, for your work. Appreciate it.
Thanks.